Thank you. And that I want to thank all of our members for their opening statements. And now we'll turn to our witnesses. And welcome to all of you. We have a very distinguished panel with us today, and I'm going to introduce them from left to right, and then we'll have 5-minute statements from each of you. First, again, to my left is Dr. Uwe Reinhardt, who's professor of political economy, economics, and public affairs at Princeton University in my home state. Thank you for being here today. We have Ms. Sally Pipes, who is president and chief executive officer of the Pacific Research Institute. And then we have Dr. Judy Fader, who is senior fellow of the Center for American Progress Action Fund. She also has been before our committee many times in the past, our subcommittee. So thank you all. And if we could start with Dr. Reinhardt. Is your mic on? I'm not sure. You press the button?
Yes, it's high tech.
That's good.
I'm from rural New Jersey, as you know, and I have to learn these things. I have submitted a statement to the committee. It falls into 3 parts. In the first one, I briefly visit the issue of costs, just to remind Americans how expensive our system is. The second one, I look at what this cost does to American families, looking sort of at the median American family. And then in the final, have some perspectives on proposals before the nation to fix this problem. Now, it is well known that we spend on a per capita basis in purchasing power parity a lot more than other nations, 56% more than Switzerland, which is viewed as a very high-quality healthcare system, and 83% more than Canadians do. And yet, if you look at health statistics, you will not find that much difference. In fact, I find it an intellectual breakthrough of major proportions that the Business Roundtable, which used to be the staunch defender of our system as the best in the world, now comes out with a report just last week talking about a 20% value gap, saying relative to other nations, Americans get 20% less value for the healthcare dollar than other nations. That's a very important recognition by these important people. I also remind people of what we call the Wenberg variations. For example, that under Medicare, it costs more than twice as much per elderly in Miami than it does in San Francisco, which is an issue I believe the Congress should begin to look into, fund research to say, why should it cost twice as much in one part of the country than in others? But it's not just Medicare. You will find the same in private insurance as well. So I believe cost-effectiveness analysis, which is a dirty word yet on the Hill, at some point does have to be embraced. It's just called operations research. There's no other industry that wouldn't look at cost per unit of output. Healthcare is really the only one. But I also would urge Congress not to say, let's do cost control first and then universal coverage, because we've said this for 30 years. We've never done the former, and I don't think you can fool God that long with the excuse that we cannot afford it. We've said this now for 30 years. It's time to go to universal coverage. In the second section, I look at the American family. I use for this not health insurance premiums, which is a very misleading indicator. I use the Milliman Medical Index, which includes the premium for health insurance for the family, plus their out-of-pocket spending. Because you can always make premiums go down or slower just by cutting the benefit package, raising deductibles, and so on. So you really should look at the Milliman Medical Index. Last year, on average, for a family of 4, it cost $15,600 for health care in America. It'd be now $16,500. Now, compare that to the median household income in America in 2007 was $51,000. So if one had the view that people should be responsible for their own health care, you would be saying for a median American family that they should spend $16,000 out of their $51,000. That's an awful heavy burden. Now, for lower income families, as your statement correctly says, 30% of available discretionary income goes for health care. So what I predict that in the next decade, I have a little table here. Use a family here with a wage base of $50,000 and say if that wage base grows at 3% and healthcare spending per capita by 8%, which is what it has been for the next decade, then half that family's wage base would be chewed up by healthcare 10 years from now, half. Even if you make very optimistic assumption that health spending grows only 4% and wages 5%, it's even unthinkable given what we're facing right now. But even if you make that, 30% of that family's wage base would be chewed up. So we're sailing into a perfect storm, and the Congress at some point faces the following question. Either taxes have to be raised on those of us fortunate to be in the upper part of the income distribution, myself included, or, and then you could have a roughly egalitarian health system, or you seriously have to redesign the system to ration healthcare by income class, which is, of course, what we have been doing already. And this is a sort of mischievous piece of mythology that government-run systems like Canada's ration healthcare and private markets don't. If you have a specialty drug that costs $100,000 a year, and you ask somebody to pay a 30% coinsurance for getting that drug, you are rationing that person out of that specialty drug if their income is $50,000. I mean, it's just every textbook in economics will tell you that prices ration is just one other form of rationing. So this is what the Congress faces. And then look in the last section at the individual market and presents several models. I don't have time to go into it, but there is the issue of the public health plan. Given what the American people have witnessed, they have seen great American companies, AIG, GM, Citigroup, go under. Given what the shock they have received, one could imagine that Americans would yearn for an option that is government, because I believe in the end it's the government Americans trust, because that's where they always run to when they get in trouble, whether they're big bankers or whether it's FEMA or whoever it is. When the going gets tough, the tough run to the government. That is the slogan, and I've observed it for 40 years in this country. So therefore, I believe that people say we shouldn't have a public option, have a tall order to explain to the American people why they should be deprived of a choice that they may yearn to have. And I then go through later on how one could make that a level playing field. It is, after all, only a choice. You don't have to choose it. You can go private, but it should be, in my view, I as a citizen would love to have that option, and I might even take it. Thank you very much.
Thank you, Dr. Reinhart. I want to make sure I got this quote. When the going gets tough, the tough run to the government?
Yes, that is the marching order of the rugged individualist.
Thank you. Ms. Pipes.
And that's probably me. Thank you very much for the opportunity to testify. I think we would all agree that all Americans want affordable, accessible, quality health care. The question is, how do we achieve that goal? And there are two competing visions for reforming health care and achieving universal coverage in this country. One focuses on patient-centered solutions, empowering doctors and patients, and encouraging innovation in new pharmaceuticals and medical devices. The other vision is focusing on increasing the role of government in our health care through higher taxes, mandates, and subsidies. This vision for greater government involvement is on the rise today, and I think we need to focus on the fact 47% of health care in this country today is in the hands of government through Medicare, Medicaid, SCHIP, and the VA system. The long-term goal of the new administration and many Democrats in Congress is Medicaid for all. And as has been pointed out, the U.S. today spends 16% of GDP on health care, about $2.3 trillion, and many people say that that is too much. And if we're going to get that percentage down and achieve universal coverage, how do we reduce the number of uninsured from the 46 million Americans? Canada, my country of birth and where I spent most of my career working as an economist, spends 10% of GDP on health care and does have universal coverage. If Canada has universal coverage and only spends 10% of GDP, why can we not duplicate that model? The Canadian government took over the Canadian healthcare system in 1974 and banned any private health care for procedures provided under the Canada Health Act. Of course, the demand for health care was much greater than could be provided by government. As a result, Canadians suffer from long waiting lists for care, ration care, and a lack of access to the latest technological equipment. A few statistics. 750,000 Canadians are on a waiting list waiting for procedures. 3.2 million Canadians, out of a population of 32 million, are waiting to get a primary care doctor. The average wait today from seeing a primary care doctor to getting treatment by a specialist is 17.3 weeks. That's over 4 months. Canada ranks 14th out of 25 countries within the OECD on MRI machines and 19th out of 26 countries in CT scanners. When the government is the monopoly provider of health care, people wait and wait. When they get tired of waiting or are too sick to wait further, they flee, if they can, and many come to the United States for treatment. Belinda Stronach, former Member of Parliament in Canada, opposed opening up the Canadian healthcare system to any private side, but when she was diagnosed with breast cancer in June 2007, she came to UCLA and had her breast cancer surgery done and paid for it out of pocket. A woman in Calgary, Alberta, expecting quadruplets last year, there was not a single neonatal unit in Calgary, in Alberta, or in Canada where she could deliver her quads. She was airlifted to Great Falls, Montana, a city of 55,000, and her quads were successfully delivered. I have many, many stories of people in my family. My mother couldn't get a colonoscopy at her age and died within 2 weeks when she was hemorrhaging in the emergency room. Dr. Brian Day, orthopedic surgeon and former president of the Canadian Medical Association, told the New York Times, Canada is a country where a dog can get a hip replacement within 2 weeks. A Canadian citizen has to wait 2 to 3 years. In June 2005, the Canadian Supreme Court ruled on a case for the province of Quebec that the ban on private health care and private insurance is illegal because of the long wait times. Madam Chief Justice Beverly McLaughlin said, access to a waiting list is not access to health care. Canada is opening up its system, while the U.S., it seems to me, is moving more towards a government-administered system. President Obama has said that employers would have to provide coverage or pay a payroll tax so that employees can get coverage within a new government-run insurance plan, which would be part of a newly created national insurance exchange. The exchange would also include private insurers. I think the government insurance and the private plans would have to have guaranteed issue, community rating, and many mandates, which will make them even more expensive. My view is that the government plan will be priced lower than the private plans. I see ultimately crowding out of private plans and taking America down a fateful road to Medicaid for all. We would then have universal coverage. We would not have universal access. Care will be rationed, taxes will increase significantly, and the entrepreneurial spirit of this country will be weakened. When we get totally socialized health care in America, where are we going to go? We can change the tax code, as has been mentioned, by removing the tax advantage to those who get their insurance through their employer. We could offer, as McCain suggested, a refundable tax credit for everyone. We want to empower patients. We want to reduce state mandates, which add between 20 and 50% to the cost of an insurance plan. I think people should be able to purchase insurance across state lines. We need med-mal reform, and if we do all that, we can reduce costs and significantly reform and reduce the number of uninsured in this country. Universal choice will lead to universal coverage for all Americans, and then we will have affordable, accessible, quality health care for all. As P.J. O'Rourke, my friend, says, if you think health care is expensive now, just wait until it's free. Thank you.
Thank you. Dr. Fader.
Thank you, Chairman Pallone and Congressman Deal and members of the committee. It's a pleasure to be with you today to talk about the critical need for affordable health care for all Americans. As I listen to Ms. Pipes, I wonder whether she is truly following the plight of Americans who can't afford health care, and whether she's following the kind of American health reform that we're really talking about. You mentioned President Obama's campaign plan. He has talked about his commitment of the choice of health plan, of quality care, and affordability for all Americans. So I'd like to get our attention back to the problems Americans are facing, as 14,000 Americans are estimated every day to be losing their health insurance as they lose their jobs, and as benefits are shrinking even for those Americans who have health insurance. The problem of unaffordability is most apparent for the now probably more than 47 million Americans who lack health insurance, most of whom have incomes below twice the federal poverty level, about $44,000 for a family of four. And if they don't get health insurance through their employers, as most of them don't, though most of them are working, they simply can't afford the $13,000, roughly 2008 cost of a comprehensive health insurance policy. But affordability, as you have noted, is increasingly a problem even for people who have health insurance. In 2007, for example, the Commonwealth Fund identified 25 million people underinsured or economically threatened due to high out-of-pocket costs, up from 15 million, so that's 15 up to 25 million in only 4 years. Similarly, the number of Americans who report problems paying medical bills has risen. It's jumped from 1 in 7 Americans under age 65 in 2003 to 1 in 5 Americans by 2007. Not surprisingly, low-income families face the greatest problems, and sadly, our valuable Medicaid and CHIP programs do not necessarily prevent these problems. No matter how low their incomes, working-aged adults who are not parents of dependent children or are not disabled aren't eligible for Medicaid in most states. And even the populations for populations they do cover, Medicaid and CHIP have been modified in recent years to give less protection in terms of out-of-pocket costs to low-income families. Finally, not really surprisingly, but ironically, affordability problems are the biggest problem for people when they get sick. In particular, individuals who are older, have an activity limitation, a chronic condition like diabetes or heart disease, are most likely to be underinsured. And if they don't get coverage through an employer-sponsored health plan, or if they lose this coverage, they're going to have one heck of a time getting it from a non-group market that systematically denies coverage, limits benefits, or charges excessive premiums to individuals with pre-existing conditions or whom insurers believe are likely to need health care. Now, I've been talking here about money problems, but we all know that health care is a problem, affordable health care is a problem of your money and your life. There's lots of evidence, and the Institute of Medicine has come out with a new report documenting once again that with people without health insurance are more likely than people who have health insurance to delay care, to get less care, and actually to die when they get sick. Sadly, evidence suggests that increasingly people who are underinsured are facing similar problems. As one report shows that they are postponing care, skipping recommended medical visit or treatment, not filling prescriptions, and skipping doses or cutting pills. The underinsured not only struggle, medically to survive. Their medical struggle, as we've heard from some of you and you've hearing from your constituents, is forcing them into bankruptcy and increasingly into foreclosure. Even people with insurance just can't afford to get sick. But we're gathered here today to address this problem, and Mr. Chairman, we are counting on you in the coming months to do exactly that. So let me give you 4 principles to keep your eye on as the committee and the Congress moves forward. First, keep your eye on families' total health spending, as Dr. Reinhardt said. Not just premium contributions, but also on deductibles, cost sharing, and spending for other services. You've got to watch out for a desire to keep those premiums low by keeping the cost sharing high. The result is going to be insurance that doesn't work when you get sick. Second, and related, remember that benefits matter. Health insurance worthy of the name has to work for people when they're sick. So despite claims that I've heard, and I'm sure you've heard, that any insurance is better than no insurance, insurance that leaves people without the ability to buy the services that their doctors and practitioners prescribe is just not good enough. Like members of Congress, all Americans need adequate benefit packages with a defined set of services. It's a critical linchpin for affordability. Third, affordability clearly depends on income, and low-income families need special protections. And finally, insurance must stop discriminating against sick people. As long as insurers can deny coverage, limit benefits, or charge higher rates based on people's age or health status, insurance is going to remain unaffordable for people who need health care. Meaningful health reform cannot fail to ensure that health insurance is affordable for people who have been or whom insurers believe are likely to become sick. We know that enacting health reform is a challenging task, but now's the time. I commend you for your efforts and look forward to working with you to get affordable coverage for every American this year. Thanks.